Welcome to our online video lecture for our content on burnout, compassion fatigue, secondary traumatization, stress, and self-care. I want to bring your attention to these two instruments that measure stress levels. I encourage you to make copies of these instruments and monitor your level of stress throughout your undergraduate years, as well as when you become a social worker. You will find these handouts in your Handouts tab in Blackboard. Please take a moment to complete the Are You Stressed questionnaire. What is your overall score? Any score that is more than 13 points should be a signal to you that stress must be addressed. What does stress mean? A specific event might cause different levels of stress in different people. Why doesn't this event cause the same amount of stress in everyone's life who experiences it? Level of stress is not solely determined by the type of event, such as an eviction, losing a home and car in a flood, or tremendous amounts of coursework in your undergraduate program. Level of stress is a result of an interaction, the appraisal of resources to cope with the event, and the magnitude of the event. The level of stress an eviction causes, for example, will be less for people who might have some savings or financial resources or family they can stay with. Those who don't have the resources to manage it will have higher levels of stress. Take a look at your score on the Are You Stressed scale again. If your score is higher than 13 points, this suggests that you might seek or allow someone to help you seek some resources that may mediate the relationship between event magnitude and stress in order to lower your felt stress level. Pictured here is the cover of a book by Shel Silverstein. He has written award-winning children's books. Normally, I read this book out loud to the class, but since this is an online lecture, I have placed a YouTube video narration of this book below the link for the lecture video in Blackboard. Please pause this video lecture here and view the video narration of The Giving Tree by Shel Silverstein below. Now that you have listened to this story, let's discuss its relevance to social work. This is not just a children's story, it is also a story about social workers. The boy symbolically represents our clients, and the tree represents the social worker. After a lifetime of the boy asking the tree to help meet his needs, the tree never says no, and at the end of the story, the boy is an old man, and the tree is a little stump who has nothing left to give. There is a connection between this story and the story of social work in terms of the topic for this lecture. This story is a metaphor for practice. What happens when we spend so much time taking care of others that we don't take care of ourselves? What happens when we spend years giving to others and find ourselves with nothing left to give? We will explore these questions in the content of our lecture today. During today's lecture, be sure to take notes, since this content will also be covered on the final exam for this class. Let's first talk about burnout in social work. Burnout is not necessarily specific to just helping professions. Anyone in any profession can experience this. There are several components to burnout. Emotional exhaustion is a state that occurs when a practitioner's emotional resources become depleted by the chronic needs, demands, and expectations of their clients, supervisors, and organization. Depersonalization, also referred to as cynicism, refers to the negative, cynical, or excessively detached responses to coworkers or clients and their situations. Reduction in one's sense of personal accomplishment occurs when social workers feel inadequate when clients do not respond to services despite efforts to help them. Burnout has negative consequences, such as staying on the job impaired, leaving the agency, or worse yet, leaving the profession of social work altogether. Some of you may have coworkers, who remain nameless of course, that showed signs of burnout and how it impacted their professionalism or behavior. Of course, stress, compassion fatigue, secondary traumatization can put a social worker more at risk for experiencing burnout. The key to prevention is understanding your current functioning, mental and physical health, and goodness of fit between you and the professional role you are in. Taking steps to address caring for yourself is also important, in addition to understanding and monitoring your current functioning. As we accompany client systems through their life challenges and problems, this is crucial to self-preservation and survival in the profession. These are the 3 stages of burnout: stress arousal, energy conservation, and exhaustion. Stage 1 is characterized by physical hyperarousal. You might become irritable, anxious, get headaches, have difficulty sleeping, or grind your teeth in your sleep, as well as gastrointestinal problems such as irritable bowel syndrome. Stage 2 is characterized by behaviors you engage in to minimize the loss of that physical and mental energy caused by a hyper-aroused physical state. In this stage, you might experience extreme fatigue, increased use of alcohol, call out sick frequently, or show up late to work often. Stage 3 is the final stage and usually requires some type of professional or medical or psychological intervention or treatment. Look out for these signs and try to catch them at the early stage so that you can actively take steps to address them. The best way to prevent burnout is continually monitoring your levels and actively engaging in self-care, which we will address in later slides with strategies. 3 areas are strongly related to burnout: secondary traumatization, compassion fatigue, and stress. We will now discuss each of these phenomena. Let's go back to stress for a moment. Stress is the dynamic interaction between person and environment where certain tasks or situations are perceived as taxing, exceeding one's abilities, or jeopardizing one's well-being. Here is a picture of Clark W. Griswold. He is a character in a movie called Christmas Vacation. And we will use Christmas Vacation to demonstrate stress. A clip from Christmas Vacation starts when Clark gets a knock at the door after a disastrous Christmas Eve dinner with all family members from out of town, and he thinks that his big bonus check has arrived from his boss, and it is instead a membership to the Jelly of the Month Club, and Clark goes berserk because he was depending on that bonus check to cover the cost of a new pool he had placed a down payment on. I want you to pause this lecture video and view the video clip below the link to this video titled Stress Video Clark W. Griswold. Once you finish watching that clip, return to this video lecture. Although burnout can happen in any profession, secondary traumatization is unique to helping professionals, social workers, counselors, nurses, etc., who listen to traumatic events such as domestic violence, gang violence, natural disasters, rape, sexual, physical abuse, suicide, terminal illness, etc., over long term. Secondary traumatization is the natural and consequent cognitive, emotional, and behavioral changes helpers experience resulting from indirect exposure to client trauma. These symptoms must persist for over a month before being classified as secondary traumatization. Secondary traumatization is not post-traumatic stress disorder or PTSD. The difference between PTSD and secondary trauma are the stressors that initiate the symptoms. For PTSD, the stressors can be any event that someone experiences directly or firsthand. On the other hand, secondary traumatization symptoms develop by being exposed indirectly to traumatizing events experienced by a client. Pictured here is a scene from the movie Precious, in which Mariah Carey plays a social worker. And in this scene, she listens to Precious disclose trauma that has happened to her. Being a social worker, especially those whose clients experience traumatic sexual, physical, or interpersonal violence or natural disasters daily, can place social workers at risk for experiencing secondary traumatization. In addition to the risk of experiencing secondary trauma, compassion fatigue is also a risk for social workers. Compassion fatigue is a deep physical, emotional, and spiritual exhaustion and felt pain as a result of long-term awareness of suffering of others, wishes to relieve that suffering, and helping to relieve that suffering. We often refer to it as the cost of caring. Things like secondary trauma, low levels of collegial support at work, and lack of self-care are the main causes of compassion fatigue. As you can see, these symptoms mirror the symptoms of burnout. In this slide, you see a scene from the movie The Green Mile, where the concept of compassion fatigue is illustrated. This particular scene is when John Coffey is talking to Tom Hanks, stating that he wants the execution to be over because he is tired and feels like there are shards of glass in his head. His character is magical and takes pain away from people, representing also social workers' experience. He expresses that people are so ugly to each other that he just can't manage the energy to care anymore. What a great illustration of compassion fatigue. Research has demonstrated that there are certain risk factors that make certain types of helpers more vulnerable to experiencing compassion fatigue than others. These factors don't mean that they will happen to those who experience them, but rather place them at a higher risk for compassion fatigue. Social workers who have been themselves survivors of physical or sexual violence, those who provide services to clients who have experienced these things, and those who have high empathy levels are most at risk. It is important here, too, to become familiar with the signs of compassion fatigue so you can monitor your risk and your need for self-care and even intervention or treatment if necessary. Compassion fatigue is tied to the NASW Code of Ethics. When we experience this type of fatigue, if we don't address it, this can lead to a violation of the ethical code of conduct, not working competently, and working impaired. However, pay close attention to and critique of the core value of service, especially the absolute of the core value of service pictured here in red. What do you think? Is it always healthy to place clients' needs above your self-interest? Is it wrong to put you first? To what extent? Some may challenge this absolute value and argue that sometimes social workers should place their own self-interest or their self-care needs above those of the clients. These are some suggestions about self-care from research that are effective. Some students that may come into this field with number 7, Save the World complex, which is what we call unrealistic. Refer to your handout, which is an excerpt from a story by Mark Parent, it published in 1998, who wrote a book about his life as a caseworker for CPS in New York. This excerpt begins when he quit CPS because he feels awful that a child on his caseload died, and he feels responsible. He does some personal reflection about what some nuns taught him when he was a student and comes to terms with the saving the world complex. Mark Parent's autobiographical experience helps to put success in helping into perspective. I hope you enjoy this excerpt, which is in your handouts for this lecture, and encourage you to read the entire book if it is of interest to you. Self-care is key to preventing burnout, compassion fatigue, and secondary traumatization. Self-care must be active, scheduled, and carried out according to our individual needs. Self-care should not be one activity you do once a year. There are several aspects to one's self-care. Please complete the handout, Self-Care Assessment, in the Handouts folder. Which areas do you address well? Which areas are neglected that need more of your attention? Use this form periodically as a social work student and social work practitioner to monitor your self-care activities. Here you see all of our own personal professional needs in terms of active self-care. We all have spiritual needs, psychological needs, needs in relationships, emotional and physical needs. So in order to stay healthy, we really have to take active measures to address health in all of these areas of our personal self. This self-care worksheet is also in the Handouts folder in Blackboard. Please complete the handout Self-Care Assessment in the Self-Care Assessment folder. Which areas do you address well? Which areas are you neglecting that need more of your attention? Use this form periodically as a social work student and social work practitioner to monitor your self-care activity. This particular worksheet allows you to identify and develop strategic plans for self-care activities. I want you all to know that you are just as important as the clients we serve in social work. Find time to take care of your mental, spiritual, psychological, and physical health so that you can enjoy and thrive in your personal and professional lives. Always remember that you are important, valued, and appreciated by clients and colleagues in the social work profession. And I want each of you to feel the same way about yourself. Please utilize the stress and self-care inventories in the future. I will see you all next week for our student presentations. Please remember to check the schedule of presentations for your specific date and time of presentation, as well as the requirements for the presentation in Blackboard in the Student Presentations tab. This concludes the lecture for today. Please email or stop by with any questions.